It's 12:03 here on 90.3 FM on this Wednesday afternoon. If it's Wednesday, it's time for Joe Steckler and Helping Seniors of Brevard. Good afternoon, Joe.
Good afternoon, John, and welcome to today's edition of Helping Seniors. Helping Seniors is the radio arm of Helping Seniors Incorporated, and Helping Seniors is designed to inform, educate, and connect seniors and those that care for seniors with resources here in Brevard County. We would like very much to see our program duplicated in other counties in Florida because we know that people are being kept apprised of new developments and how they can get help, and that's the purpose that we have sponsors for our product and our show, and that's the way we do it. And my panelist today is Pam Giles, and Pam is the co-owner of Verus Health Partners. And, Verus Health Partners is one of our sponsors for the program, as well as other organizations, and we cover a whole. And last week I read every blessed one we have so that we could understand the range of people that are connected with care that help. And it takes a whole plethora of people to do this work. Versus is one of our partners. We have Vitas Hospice. We have Bill Johnson, elder law attorney, Zahn Retirement. We have August Belton Financial Planning. And then we throw in somebody like Pit Crew Roofing because seniors seem to have a lot of problems with roofs. And it's sad to say, and I'm sure that Pam has seen this in the industry, in the insurance industry, that seniors get taken a lot by roofers. And she's on the other side of the glass from me today in the studio, folks. But welcome, Pam. How do you?
Hi, good afternoon. I'm glad to be here. Thanks for having me.
Listen, you're just got to loosen up and tighten and we want to talk. This is a Talk to Me radio show, and we have fun, Pam. It's fun to do talk radio, and one of the reasons I say it's fun is because just by simply the two of us talking, we make our listeners aware of the many things that they can do to help themselves, help somebody else, be informed themselves so that they can tell others about what's happening, and sort of set the stage for what you and I are going to talk about today. How about just telling our listeners what Verus Health Partners is, because it sounds like you're a care outfit, but that's not it at all.
Yeah, we certainly care about our clients. That's why we have the philosophy we have. We're a veteran-owned company. We are independent agents, and being independent is an asset because we can counsel and assist on various Medicare options that people have. And our primary thing is to educate, research, and to advise our folks on Medicare. Many people see the Medicare maze. People get inundated with things as they turn 65, so we try to help clear those things up, try to give guidance and direction as people move into the world of Medicare. So that's what we do. We also advocate. You can do this through Tallahassee, and we can do this also through D.C. In fact, Keith, one of our partners, actually our founder and owner, he's going to be going up to D.C. next month and be addressing Medicare issues that might affect people nationwide. So we try to have our voices heard.
Well, let's just talk about that for a minute. Because you say Keith is going to Washington, and he's going to be talking about veterans, or is he going to be talking to a Veterans Affairs group, or what exactly, and how is he going to advocate for seniors or in Washington? What group is he going to be talking to?
The way we have it set up, we go up there with our National Association of Health Underwriters, and we have information, whatever laws or things we want changed in the health market as a general rule, which affects Medicare as well as independent or individual health insurance is. So anything that applies to the health marketplace, we go up there and we try to make a voice. We meet with the constituents up there and just try to say this is what we're looking to try to change, what we're looking to try to do. And that's once a year we do that in D.C., and they also do it once a year in Tallahassee. So
well, when you say you try to affect change, what can, when you say underwriters group, how many people are involved in your association so that they could possibly make some kind of a difference?
Well, there's several people in the association from Verus because we're members of the association. We go up, 1, 2, or 3 of us just from our in our case, it's just keys from our office. But it could be, anywhere from 10 to 20 people that go up. It just depends. There's a team of people that go up there, and we try to meet as many of our representatives as possible.
So when they go up there, do they start lobby the representatives? Is that what
Yes.
you're doing?
Yes.
So that's where you, as a for-profit organization, can differ from helping seniors as a nonprofit. We can't lobby. We can think things are wrong, but we can certainly make you aware of what we don't like, and then you can do all the lobbying you want, that's fair and legal.
Correct. We get, we actually have people that are lobbyists, but we go up, like I said, once a year and just support our lobbyists in putting our input in and trying to affect change or add to change that does affect everybody overall. And of course, as individuals in having Medicare, we can say, hey, we like this, we don't like this, and so we can go up there and try to say this is what, the people are asking for.
Well, give the listeners an example of something that Keith might talk to to our representatives about, something that they don't like. What kind of things do you all get about Medicare that you don't like, or you'd like to see changed? We just don't know this.
We could, one of the things which is more than just Medicare, address issues concerning Medicare for All that's been spoken out there. Prescription drug information, more transparency, meeting the donut hole, the cost of prescription medications. We could, address what's going on with prescription drug options, things we want to have looked at. I don't know what the topics are specifically this year, but those are the kinds of things that we can address, things that personally affect any of the laws that might change as far as our health issues go, health insurance or Medicare insurance goes.
Okay. So let's sort of go back to where we first started. Verus Health Partners is actually an insurance agency, right?
Correct.
But we do a lot of work with SHINE, serving the health insurance needs of Florida's elders, and we send a lot of our callers to SHINE so they can get the best Medicare supplement that they can that they're not paying a fortune for that kind of insurance. So actually, they could refer our callers to agencies like yours, because you deal with insurance supplements for Medicare.
That's correct. Yeah. SHINE, I would like to say we could partner with SHINE, or we can, after they have initial contact and get information from SHINE, we can be one of their resources that they send people to, and we can actually research plan options for them. We can help them select plans and actually enroll them in a plan. And we can review plans that they might currently be on. And a lot of people don't realize things about their plans. For example, we're going to go back to prescription drugs as a really big issue.
Wait. Go back. Run that one by me a little slower, because
okay.
If I didn't catch it, I bet a lot of our listeners didn't catch it, because I think you said something important when you started talking about donut hole and insurance in that regard.
Yes, that's correct. one of the things we do when we talk about researching prescription drug plans and prescription medications is a high cost item for people, or it can be a high cost item for people. So what we do is we can take and look at what people might have for medications, and we take a look at formularies, because there's a lot of separate different Medicare plans out there. So we take a look at formularies and explain to them where it is on a formulary, so we can help them pick out a plan that might be more cost effective. Some medications, when they're brand names, when we talk about the donut hole, people can be facing those extra high costs. And so we try to come up with a strategy to help them avoid that donut hole or the high costs. So those are all part of the things we do when we go into research, and then we sit down and select, and then we give you some other options that might help you.
How could you help somebody avoid the donut hole? How can you do that?
We advise individuals. There's other options out there. For one, if you're using your plan, there's ways to use preferred pharmacies over standard pharmacies. And a preferred pharmacy is where you're going to get your lowest copay. A lot of plans offer mail order options. Mail orders sometimes give you a zero copay, so we discuss those things. 30-day versus 90-day prescription plan orders, we talk about that. And there are some other options available. Extra help is a good time to kind of talk about that a little bit. Some people don't realize they might be eligible for what's called extra help or limited income subsidy. So we will take a look at that information and assist in applying for that benefit. If someone qualifies for extra help, which is a federal program, they're going to get the lower co-pays for their medications. So we take a look if somebody's eligible for that. We also advise them to make sure they talk with their primary care physician and say, hey, look, if I can use, the generics versus a brand name, and it works for me, then that's going to cost them less money as far as the copay market goes. And there are some other options, samples. Doctors sometimes can provide samples if maybe they're getting close to the donut hole. And there are some other options out there that we can talk to them about as far as there's programs that they can try to get help through. One of them we advise is people can go to Prescription Hope. A lot of people aren't aware of that. And
what is Prescription Hope?
Prescription Hope is a program. Basically, what they do, and it's somewhat income based, but it's and they can help you other ways as well. And you can find them online. It's like I said, it's just another way. What they do is when you work with Prescription Hope, they arrange for you to get a high-cost medication, and you're actually not using your prescription drug plan. And so that helps them get, for example, a brand-name medication, and you're only going to want to use a brand-name medication with them because you pay a specific fee for each medication, and that helps people save money. Canadian meds are becoming popular, so there's Canadian med stores sometimes are an option also. So we kind of just look at where somebody's at, take a look at what medications they take, and try to come up with a strategic plan on what's going to be most cost effective for them to help them stay out of the donut hole.
Wow. So, it's when you mentioned Canadian Meds, we had a company called Canadian Meds was on our radio for a long time. I have to talk to Joe Bonds and find out when I'm going to get him back on here, because he provided a lot of useful information about drugs that we could purchase from Canada. And the ironic part is those high-cost drugs that they sell cheaper are made right here in the United States. But the one thing that they haven't been able to crack, and when you talk about high-cost drugs, insulin.
Yes.
Insulin, I think there's something like 4 companies that make insulin, and they're all right in the United States. So they're sort of forced to use the United States suppliers, and insulin is very expensive.
Yes, it is. Yeah, that's a big expenditure as far as the donut hole goes. That's why it's important at that point. We can take a look at like possibly a Canadian Med option or extra help. That's a good way to look at it to see if someone qualifies for extra help, because that's where they're going to save costs on those particular medicines.
Could this company like Operation or when you said Hope, could they help you? Could they help a diabetic get insulin at a lower cost?
Yes. The way the Prescription Hope works is it's actually what they call a administrative fee, and once you set yourself up with a Prescription Hope possibility, again, like I said, it's got a bit of a financial base to it. You have to have a certain financial qualification level. I believe it's $30,000 a year or less as a couple or an individual, I think it is. But with that one, they will cover. You can once you do Prescription Hope, and what they do is they work directly with your doctor and they'll get your medication for you. So you're getting that particular medication and they just get it at a lower cost for you, or you pay the administrative fee and they take care of getting the med for you.
Okay, we're going to talk about that some more in here, but right now we got Kerry Fink on the line. Hello, Kerry.
Hey, good afternoon.
Yeah, can you hear us all right?
I hear you guys just fine.
I hear you fine too. Sometimes I don't want to hear you, but I hear you fine. This is a good time to hear you fine. But Pam, this is Kerry Fink, and Kerry's he's our media guy, and he's down at the Melbourne Auditorium with the. What are you down there with, Kerry?
Well, actually, slight thing. It's at we're actually at the Wickham Park Community Center, and we're here with Helping Seniors for the Young at Heart Senior Expo and Fair. And it's been, I was wondering a little bit. We're enjoying Florida sunshine, but it's a chilly kind of day. But it hasn't hurt attendance. They've had record attendance here this afternoon at the Senior Expo, which goes on until 1 o'clock. We've got lots of people stopping by the Helping Seniors table. They're getting a copy of the latest edition of Senior Scene magazine. We have all the information about the Helping Seniors car raffle. People are buying tickets. They're taking tickets home and mailing checks back. And there's a lot of interest in this, which, as you know, is a big deal. It all comes to a close on April 27th with that big party at Mark Pylock's American Muscle Car Museum. So if people are interested in that, there's lots of great friends of Helping Seniors here. We've seen Debbie Fisher with the Brevard Relocate Realty Group. There's lots of Vitas Hospice Healthcare is here. So a lot of the friends of Helping Seniors are here at this event, too. It goes on till 1 o'clock at the Wickham Park Community Center.
Do you have a big crowd, Kerry?
You really did. They planned for somewhere around 400 people at an event like this. They ran out of bags in the first 15 minutes. And, in fact, one gentleman who volunteers from time to time to help us video things, Robert Muchler, he came by and he said, Kerry, he said, I had to circle the parking lot 5 times waiting for somebody to leave so I could get a place to park to come inside. So it's really been that kind of an attendance. So it's really been a good day, and it's still time to come out because it goes on until 1 o'clock this afternoon.
Okay, Pam, did you say you had somebody over at that Young at Heart event?
Yeah, I think we have an agent over there. Jeff Mark, we should have a table, Verus Health Partners. Blue
you absolutely do. Yep. I talked with Jeff Mark earlier today, and he set up. There's all kinds of things. People come down here. They even bring out a place that does mobile driver's license renewal, so you can literally stop back by here and just get your. You don't have to stand in line at the DMV. You just walk right up, and they can take care of stuff like that right here on site. It's really fascinating. There's several of these that are coming up. And we're going to have the Helping Seniors raffle cars out at some of the ones that are coming up. There's one in Barefoot Bay that comes up, I believe it's March 19th. And then the Mega Senior Expo, where we're going to have all 3 cars out there. So it'll be the perfect time to come see them, is Wednesday, March 27th. But there's lots of great appearances. If you haven't had a chance to see these cars, it's really exciting when you see them all 3 together. It's just fun.
Did you get the convertible over there this morning?
No, we don't have the convertible, but we have posters and we have signs and we have the inserts, and we're sending a lot of those home. There was a gentleman who came by last year. He said it was such a great event at the American Muscle Car Museum. He was there when we drew the winner for that beautiful 1951 Ford that AJ had so kindly donated, and he said, I want to make sure I'm here when you guys do this again. So he bought his ticket on site and wanted to be sure that he was going to be like first in line the next time on April 27th when they open up the doors for the American Muscle Car Museum for our grand prize drawing for the Helping Seniors raffle car.
Well, listen, you're in charge of that, getting those cars there, so you can drive a car, but you can't drive that poster you're handing out.
well, if judging from the story about the parking lot, I'm not sure where there would have been room for it today. But there's some events coming up at the beginning of February that we are looking forward to having the cars at as well. So a good place to always stay up online with this is on the Helping Seniors Facebook page, because we'll post anytime the cars are out or there's an opportunity to come out and meet us and get tickets. That's always going to be on Helping Seniors of Brevard's page on the Facebook. So that's one really good resource to always stay up to date.
Okay, let's get serious and get down to business here for a minute. More than collecting pens and picking up pill boxes at these events, what do the people that go to the events, what should they really be taking away from there, Kerry? It's I've never asked you that question, but I have my own thoughts. What are your thoughts?
Well, it's so interesting because there's such a dynamic. There's a lot of nonprofit groups that are represented here. For example, obviously we're always to be found at these. We met several of our friends from the AARP Association who are here. Like I said, the Department of Motor Vehicles is here. There's people from the Department of Elder Affairs that are here. So there's a lot of information, just straight out good information that's there. There's a lot of vendors here that do everything from they're like we were talking about. Our friends with Verus Health Partners are here providing people with information. It's a nice place that people can come in and just get information without feeling like they're being sold to or something like that. Of course, people come in and they want the pens and they love the donuts and the coffee and all those kind of things. But a lot of times it's really about the information. So, for example, Debbie Fisher with the Brevard Relocate, she's an expert on the 55-plus real estate market. So she's here talking with people. They may be talking about downsizing. There may be snowbirds who are here that are thinking about maybe coming here year-round. So it's just a good place to get general information. There's folks like Vitas Hospice. There's so many organizations that take the time to be here, and their objective is they kind of view it as community service, the same way that we do as an outreach. It's our chance to, like I said, today it's probably been 800 people through the doors to just make sure that they're aware of what Helping Seniors does and our senior information helpline and the things that we do. So we spend half the time just presenting information about who we are and how it can be helpful. In fact, there was a gentleman who spends his time between Hawaii and Florida, although he said, with this weather, I'm thinking about going back to Hawaii. But he's very interested in the work of Helping Seniors and how we advocate for seniors. So he's a guy that I actually have his card, and it encouraged him, Joe, to speak directly with you, just because he really thinks there's so much room for advocating for seniors on a state level, and wants to see more of that, and is willing to want to be part of whatever we're doing to try to help that move along. So it's really fascinating. People come out for different reasons. Some come out, like you said, maybe just for the pens, but a lot of them come out to really get some good information.
Okay, I'm going to have to take a knife to cut your throat and get you off the air for a minute. I'm only joking, but, when you get started talking, Kerry, you get going with that information. It is really good, but, you get so engrossed in what you're talking about because you believe in getting information out to people, and that's so important. And I thank you for sharing what you're talking about at the Community Fair Center with us, like the Young and Heart thing, because information is so important. And with that thought, I'm going to thank you for calling in, and we're going to take our mid-show break right now, and then I will come back on with Pam Giles a little bit more about Verus Health Partner and get back to that. But I wanted our listeners to hear a little bit about the health fair. Thank you.
With the second portion of our show, and here's your host, Joe Steckler.
Thank you, John. We're back on the air live with Pam Giles, and Pam is the co-owner of Verus Health Partners, and the purpose of helping seniors is to inform, educate, and connect seniors and those that care for seniors with resources. And Verus is one of our health partners. And, without sponsors, Pam, nonprofits don't exist. And there's so much going on in the paper today about what tax money should be used for and who should fund nonprofits. But from being the director of a nonprofit program, I just want to say thank you to partners like Verus that help good things happen. And, listeners, it's really important that you understand some of the dynamics that are happening in the country today with the thought that taxpayer dollars should not help fund nonprofits. Should not even be responsible for, government should not even be responsible for helping make information available. I don't think that's right. They say that all this should come from private donors. Well, a lot of private donors don't see the way managers and those that do their very best and work hard to get information out and help people. But thank goodness we do have organizations and companies that do understand the problem, and once I realized what Verus does, it made me more appreciative of the fact that you're one of our sponsors. And one of the things, Pam, that got my interest was the fact that you made a comment that we have a new enrollment period this year, and I want to know more about that myself, and a difference in the enrollment period could possibly affect about 250,000 people in Brevard County. So I think our listeners should pay attention to what you're going to say.
Sure. Normally everybody's used to what's called the disenrollment period. We've got our big annual enrollment period, of course, that's October 15th to December 7th, and then you were allowed to disenroll. But sometimes people during the annual enrollment period, they go to plans that they think are going to work for them. They think that they're going to get the doctors that they need, or at the time they enrolled, it seemed they had what they need. But sometimes come January 1st, maybe the doctor switched to another network, or the plan didn't have something in there that you think you need to help with your Medicare plan for the next year. They've brought on what they call an open enrollment period. And basically what this does is it just allows individuals who signed up for a Medicare Advantage plan, and instead of just being able to disenroll and go back to original Medicare and then pick up a prescription drug plan, this year you have a one-time option to switch your Medicare Advantage plan if you would like to do that.
You say switch your Medicare Advantage plan?
Mm-hmm. So if you signed up for a plan, and I'm going to just say you signed up for a plan and you found out your doctor moved to a different plan's network.
Okay.
You could actually switch your Medicare Advantage plan. Now, this is only a one-time...
Wait. You can switch that Medicare Advantage plan to the network that the doctor is in?
Yep, to a different Medicare Advantage plan. You
right.
could go to where your doctor moved to.
Okay, but not just to switch. It would have to be to where your doctor went?
No, I'm just giving you an example.
Okay, all right.
For whatever reason you choose to switch your Medicare Advantage plan, you can do it one time this year.
Okay.
And this open enrollment period, like I said, it's a one-time switch, And it's from January 1st to March 31st is when this open enrollment period is ongoing for. So people can switch to a different Medicare Advantage plan. People can also, if they wanted to, still drop a Medicare Advantage plan and return to original Medicare, which was what the disenrollment period was already. Okay, they can still disenroll. They also can sign up for a standalone or a prescription drug plan, a PDP plan, if they return to original Medicare. So basically, what they've added is the option to switch Medicare Advantage plans versus just doing a disenrollment, which is what we had previous to this year.
Tell me something. Would other insurance agents / companies that sell the same type product you do come on this radio show with me and tell me that they do the same things that Verus Health Partners does?
I would hope that we would have other agencies out there that do the same thing we do. I know we spend a lot of time researching and trying to help people make the right decisions, and that can be very time consuming, and you can spend hour or 2 hours with someone only to help them realize you're good just where you're at. You don't need to make a switch. And that's okay, because that's what we're here for, to make people comfortable or understand where they're at and educate them. And I think that's one of the things that we do and we try to do very well. And I think that's maybe a step above or a step different than you might get somewhere else.
Well, I sort of loaded that question up a little bit because I asked you before the radio show if you work with Shine, and you said you did. And that caused me to think a little bit about a for-profit company like Verus Health Partners willing to take the time to work with the Shine people to find the right insurance program for somebody. There are so many people out there, Pam, that probably do not realize that they don't have the right plan. There are probably a lot out there like that. And one of the reasons they are like that is because they're not aware that Shine exists, or they're not aware that there are for-profit companies like Verus that take the time to do what you do. And I say this because I have looked at some other insurance places, and I know that as I sit here and speak, I'm a veteran, and I know that you all have, you're an Air Force veteran, your husband's an Air Force veteran, one of your primary people in the office is an Air Force veteran, and I know that you work with the VA office here in Viera. Am I correct?
Well, we are definitely out to educate our veterans as well. Also help educate agents about working with veterans, because a lot of individuals don't realize what veterans have for their benefits. And there's different levels of serving your veterans. And one of the things we talk about is VA benefits.
Right.
Depending on a level of disability, some members have maybe 10 or 20% disability, and they get VA benefits, which isn't full VA benefits, which is obviously 100%. The VA benefit services, the health, just the medical, the health side, if you want to compare it to your Part B, it's not actually what's considered credible coverage, because the VA just offers services to the veterans, but sometimes they're not going to get everything that you can get for Part B, or they could actually end up getting a penalty if they don't pick up their Part B. But we try to go over that with individuals so they understand the differences if they actually have a VA benefit. For example, Part B is a premium to be on your Part B. So a veteran might say, well, I get the VA, I'm going to use the VA, I'm not going to pay for the Part B. So what we try to do is review where they're at and inform them that they could face a penalty or if they don't get their Part B within 12 months of being eligible.
What is Part B, Pam?
Part B is the actual health side of your benefit. And so what we try to do is go over it with them that you want to make sure that you have full coverage. And a lot of times if you're using the VA, obviously if you can use it, you don't want to have to pay that Part B if you can avoid it.
Let's go back.
Mm-hmm.
You understand this a lot, and I'm sure that there are many listeners that truly understand this, but Part A is your hospital care, right?
That is correct.
Part B is the supplement, right?
Well, Part B is like your medical coverage. Basically, your doctor visits, your screenings, anything that is your doctor visits. And you can complement your VA by being on a Medicare Advantage plan, or you could even pick up a supplement. But what you do is you get to see a doctor besides the VA, and you get extra coverage. Sometimes the Medicare Advantage plans have additional things like over-the-counter credits. There's different benefits that you can get with a Medicare Advantage plan, so we go over that with individuals because a lot of them just think that they're okay just being on their Part B, or I'm sorry, not having Part B, so we try to clarify that with them.
Well, let's talk about this just a little bit more because I want to make sure that we're on the same path.
Okay.
Part B is the 20% that Medicare doesn't cover. And when you talk about doctor visits, going to a doctor's office, if you're in a Medicare plan, healthcare plan, you have very, very low copays. That's one of the reasons that people go into a Medicare Advantage plan.
Correct.
Now, let's say I got a real concern that came up when you mentioned that if people go to the VA, that they would not pay that 20% or get the supplemental insurance because they feel that the VA could cover that doctor part. And based on my own experience, and I don't think that's true. I think people are ill-advised if they don't take the Medicare Part B.
That's correct. Because I have in my notes a lot of individuals, like you said, if they have the VA health clinic, it's not considered credible coverage, and Part B medical services gives you the full coverage,
right.
And yes, and you can use the VA or you can use a Medicare Advantage plan that helps pay that. You get services without having to pay that 20%. That is correct.
Right, but this is a case where you could be penny wise and pound foolish, because I also on the converse side of that, I have run across a lot of retired officers are people that went to the service academies that they didn't stay in and retire. I mean, they come under the VA, but they don't even realize that they could get hearing aids at the VA. They didn't realize they could get glasses at the VA. The VA also has a dental clinic, and I'm not that tuned in on who can get coverage at the dental clinic. But when I go out for my eye test and get my glasses, the other side of that section where I go is a complete dental clinic, and there are always people lined up for that dental clinic. And there's so many people that veterans especially, that for a lot of reasons they just don't think they have the money to get the dental care that they need, and they don't realize that it's available to VA. And I was really interested to hear that one of the things that you and your organization does is talk to your clients and find out who is a veteran and works that closely with the VA out at the government center. Yes,
because going back to what you said, there are special circumstances. If someone's 100% disabled, they can get services at the clinic, and it depends a lot on your VA level, whether or not you get dental benefits. So we definitely, have individuals talk to professionals as to what their VA level is and what your services are. And just like you said, you can complement and kind of get the best of both worlds by knowing when you can use the VA or when it'll be beneficial to use a Medicare Advantage plan. But I've talked to several people. The hearing aids has been a great thing that they've gotten out of the VA that they didn't realize that they could get. So we try to sit down and look at what you can do to, like I said, get the best of both worlds, get what services you can from the VA. And sometimes it's a lot easier to get local services through a Medicare Advantage plan if you can't always get into the VA. Urgent care clinics are a great option for you because you can't always get to the VA if you need to see an urgent care doctor. So if you're enrolled in a Medicare Advantage plan, you've got urgent care, lower copays. So we talk about all of those things with individuals, but yeah, it's using what benefits you can from the VA versus what benefits you can use from your Medicare options.
And you got the best of all worlds then if you got that.
Yeah, try to get it set up that way. Yeah. Exactly.
And the reason we're talking about that, folks, is so much is because there happen to be roughly 75,000 veterans here in Brevard County. And when you talk about your senior population, that's a lot of veterans, and many of those veterans qualify for the VA. And for all of those that question VA benefits to people, I just sometimes you should go out there and sit and watch many of our. I have not seen any women yet, but men coming back from Iraq and Afghanistan that have prosthetic legs, and there are true veterans out there, people that have served in World War II, Korea, Vietnam, Iraq, Afghanistan, you name it. We've got over 30,000 men and women that have been wounded as a result of our number of years in Afghanistan alone. And that is a lot of men and women injured, folks. And women have been injured the same as men, and it's been mostly from the IEDs, the roadside bombs that have blown everything up. And nobody's immune to that, whether they be a man or a woman. And I got my own thoughts about who should be fighting where and what, but nonetheless, they are veterans. They're entitled to their benefits just as civilians that live in the United States that have never served are entitled to the best type of insurance coverage that they could get, Pam. And that's exactly what Verus Health Partners does. And I wish you'd just talk just a little bit about how your company takes people with insurance policies, and you might say, here's a better way to approach the whole outlook. How do you go about doing that?
As far as taking a look at what somebody has and working with them from there?
How do you look at what somebody would have and say, oh, gee, I can get you better coverage at a cheaper price? Or you find somebody that is really pushing the limits on their ability to even have that 20% coverage. How can you always find, or can you always find a way to insure people that have minimum income? I'll back up a little bit on I'll try to put everything together for you. I'm going to address the VA one more time before we move on from our veterans. Another thing you might have heard about veterans is TRICARE and TRICARE for Life. Okay.
We've run into individuals, and this is going to kind of connect with how we're going to go with our question, but TRICARE for Life is like having a Medicare supplement. And we found that some people have TRICARE for Life, and then somewhere along the line, someone enrolled them in a Medicare Advantage plan, and now they've got 2 or 3 things that they're enrolled in. They don't even realize that they're paying for one thing when they don't need to be paying for it. So basically what we do when we get somebody in front of us is we take a look at what they have, and we sort through what they have and come up with, for example, we had an individual that had TRICARE for life, and the individual knew they had TRICARE for life, but somewhere along the line someone went ahead and put them in a different Medicare Advantage plan also, and that's part of educating agents as well to know the difference. And I'm going to add that's one of the things we're going to have a Medicare Summit with one of our Florida Association of Health Underwriters this year, and we're going to have a veteran piece on that to help people, or agents I should say, when they run into veterans, things to look at. What do they really have? TRICARE for life is like having a supplement. They don't need to have a Medicare Advantage plan. They have what they need through their TRICARE.
I tell you, Pam, when that first came out, I didn't completely quite trust them, so I kept my Med Plus for an additional year just to make sure that the government wasn't going to back out, because I figured what I was paying for my supplemental at that point, he had been retired a number of years, and we used to have that before TRICARE, and to me, the government could change their darn mind all the time. So while I had a good price on a Med Plus, they kept it for carrying me for a year. But after I was convinced it was going to stick around, I dropped it and saved myself $1,200.
Exactly, and it's amazing. You'll sit down with individuals and they have 4 or 5 cards, and some of them they're on the same plan, but they have 3 years worth of cards or something. So we just to help them go over everything they have and say, okay, this is good, you can keep this, you don't need this, let's drop this. So basically it's being able to get in front of them, and we go over, I want to say the ABCs of Medicare, but we go over what your options are and what you have if they've already have several things, and we drop what they don't need and keep them in the plan they need if they're already in a plan that is good for them.
I have a question that probably a lot of our listeners might have. On the way down there, my wife and I were talking about the cost of medicine and the high cost in the United States. And we recently, there was a pill that came out for cancer treatment. But the pill cost roughly $240,000 a year for those that took it. And who pays for the cost of drugs like that? Or is there a government supplement plan or something? Can people actually get that drug? How would they get it if they can't? Not too many people could afford that.
No, honestly, depending on what the drug is, a brand new drug, some new drugs, it takes a while before they even come onto the formularies. So people are paying cash out of pocket, maybe getting discounts, somehow getting it through their doctor. A big thing is if it's a new medication, it might not be on a formulary, and then we take a look to see how else they can get it. Otherwise, individuals are if they can't work with their primary care physician who suggests they take it. I guess the point I was trying to make is if a medicine costs that much, Pam, it would not seem fair to somebody that needed that medicine and couldn't afford it and would die. And I just wonder how someday how our insurance is going to cover situations like that. And we're almost out of time, so you got about 30 seconds to answer me. Well, I would certainly hope there's a way to get that medication. There's sometimes a pharmaceutical that comes out with a medication will work with an individual. It will certainly be an individual basis between who they are and their doctor and how they might be able to get the medication. But those are a couple of avenues to get it to. Sometimes the pharmaceuticals will give you samples if it's new. Sadly, some people might not be able to have access to it because there's not a way to get it.
Okay. We're out of time, and
thank you.
I want to thank you for the information that you've been able to give to our listening audience today, Pam. I enjoyed it, and I thank you, and I hope you listeners have profited by what Pam Giles, co-owner of Verus Health Partners, talked to you. If you have a question, call Pam. Just
You can call us at our office, 321-421-7389.
Quickly, get that number out.
421-7389.
Say it again.
321-421-7389.
Okay, I think we got it in. Okay, thank you again, Pam. Bye-bye.
Thanks.